How can I get my period back? Where did my period go to? Good day, everyone. My name is Gwendolyn Halley. I'm a seasoned and certified medical microbiologist from the UK, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health medicals, farming because I love farming, and a lot more. And I do this like no other. If you're just joining this channel, don't forget to subscribe and turn on the notification bell so that you will be the first to watch our new videos. And if you're a returning subscriber, this is me telling you, je t'aime. Let's go there. Welcome back. Into this class, we're going to be looking at how we can get our periods or our menses back, and where do our periods go to, and why we don't have periods. I would like to say that the medical term for when a lady doesn't see her period is amenorrhea. So please do retain this word because I'll be using it frequently in today's class. So there are normal situations where a lady, if a lady doesn't see her period, is considered as being normal, and there are abnormal conditions, with amenorrhea. So what are the normal causes of amenorrhea? When a lady is pregnant, when she's breastfeeding 24/7, when she has hit menopause, and when she hasn't reached puberty. Now, what are the causes of amenorrhea? That's we're looking at the abnormal side. If she has a problem in her brain, her uterus, or her ovary. And when we are talking about brain, we're talking about the hypothalamus, the pituitary. There are two types of amenorrheas, the primary and the secondary. But before I dive into that, I want to take you briefly into how menstruation works. Okay, if we are looking at the woman's anatomy, from the fallopian tubes, the ovary, the uterus. When it's that time of the month, the pituitary gland releases follicle stimulating hormone, and that follicle stimulating hormone hits the ovaries, and an egg is released. When the egg is released, the pituitary releases the luteinizing hormone, and that luteinizing hormone then causes the egg to move. Now, when the egg is released, it also releases progesterone. And that progesterone is responsible for, preparing the uterus for childbirth, the thickening of the walls and all that. So, while preparing for the victorious sperm to run and fertilize the egg. Remember, it's just one sperm that fertilizes an egg. So what happens here? When there is no sperm, what happens? This egg gets absorbed in the body, and the walls that have been prepared by progesterone just shred and come out as menses. So as you can see, you can actually have a bleeding and not ovulate. But that's a topic for another day, and I think I did a video on that, which I think you should look at. But in this case, you're seeing how menstruation works in summary. I've not gone into details because of the time. So when we are looking at primary amenorrhea, the primary stage of amenorrhea, we are looking at a girl who has never had her period right up to 15-year-old. And when we are looking at secondary amenorrhea, we're talking about a lady who started having her period and then stopped seeing her period at a certain time in her life. What could be the causes of primary amenorrhea? And the first is genetics. It could be a chromosome abnormality, and that is not very common around the world. The next point is she may have some structures that are not properly developed, like the hymen. The hymen could not be perforated. That means her hymen is closed, and it's only when she'll start having pain in her pelvic that when she goes to the hospital, they'll find out that she had actually been bleeding and the blood is not able to come out. So their doctor will have to do a minor surgery to actually perforate the hymen so that menstrual blood can flow out. Another example of abnormal structures is when the cervix has not opened. When she's born and her cervix has been closed. So in this case, we're talking about a closed hymen and a closed cervix. And also in the third case here, we're talking about a problem in the brain, a problem with the pituitary. Either she has a tumor on her pituitary or there are abnormalities on her pituitary that is causing her maybe to have an increase in a hormone, or maybe prolactin or another hormone. That means her body isn't functioning well, so she's not able to menstruate. Now, when it comes to secondary amenorrhea, there are a lot of causes. For example, chronic diseases. If a lady is extremely ill, especially if it's an autoimmune disease, she wouldn't see her period. If she's going to chemotherapy, her period would travel like real far away. If she's going through radiation therapy, that would be the same thing. Her period is going to travel. Also, stress causes it. When you are so stressed for a very long period of time, sure, you're going to experience this. Now, the next point is hormonal imbalance. Hormonal imbalance is very common. Very, very common, particularly with progesterone. When you have extremely low progesterone and it's affecting your ability, the ability for your body to thicken, the uterus to thicken. And when your uterus cannot thicken, there will be no shredding, there will be no menses being formed. Another point here is if a lady, hits menopause before 40, that's a serious issue. She will need to see her gynae to actually sort that out. It's not normal for a lady to hit menopause before 40 years of age. So do speak that with your GP. We're also going to talk about pituitary disorders. That is, if a lady has a tumor on her pituitary, or there are any form of abnormalities with her pituitary, that the pituitary is responsible for the releasing of hormones in the body. It's a very important organ in the body. So with this case, she may have her follicle stimulating hormone not being released, or her luteinizing hormone not being released, or it's released in excess, or it's released in small quantities, So a lot of things don't really work right. Or maybe she may have high prolactin levels. And also polycystic ovarian syndrome. That is a very common cause of amenorrhea. It causes a lady not to ovulate at all. Another is birth control pills, particularly hormonal pills, hormonal injections, hormonal implants, hormonal devices that are being put in the body. They will alter the level of progesterone in the body, and that will affect menstruation. In fact, there are some ladies who actually go for a long period of time not seeing their period while on this hormonal birth control or these hormonal contraceptives. So please, before you go into hormonal contraceptives, please make sure you've had all your kids. Trust me, make sure you've had all your kids, and try to look into the alternative of vasectomy, where you would still be seeing your period, but you won't be able to release any eggs. Or if the egg, you understand? Go into vasectomy, go into something else. You and your spouse can actually talk about this and come into a conclusion for better ways to which you can actually do family planning, which is very important, so you don't have kids that you don't want. Next is ovarian tumors, and we are talking about fibroid polyps that actually grow in the uterus. Remember, I said for abnormal amenorrhea, the problem should come up from the brain, the pituitary, the ovaries, or the uterus. The next point is previous uterine surgery. There are some surgeries that has to do with our uterus or our womb, and it's not done properly, it would really affect our ability to menstruate. Leftovers of miscarriages or abortions. And this is in line with the point I made earlier before this. In this case, we're talking about leftovers of miscarriage and abortion. It's when, every leftover is not taken out of. Every tissue, foreign tissue that's not supposed to there, is not taken out. So these leftovers prevent the thickening of the walls, and in most cases it leads to a bacterial infection. And if it is not noticed much earlier, it may lead to septicemia, and it's not very good. Septicemia leading to septic shock. So it's very important that if you're having an abortion, which I don't advise, I'm not for, or you had a miscarriage, make sure that every material is taken out from your body. Poor nutrition, yes. If you have a poor diet, especially low in iron, you are not going to see your menses. And the last point, which is very obvious when you hit menopause. So guys, we're going to look at how we can call our periods back, our menses back. What can we do? And the first thing I'm going to say is you need to go to the doctor. You need a specialist. Don't do self-diagnosis, self-treatment, self-prescription, which I don't advise. Medical specialists are there for us. So when you go to the doctor, the treatment will depend on the cause. A couple of tests will be run. A brain scan would have to be done on you to find out if you have a tumor on your pituitary, if your pituitary has been tampered with, is there any abnormalities. A more deeper test on MRI will be done for your brain. Very important, guys. Very important. Don't minimize that. Don't just go taking medications when you haven't really found out if the problem is from your brain. A couple of blood tests are going to be done to check your level of progesterone, to check your thyroid levels, to check your prolactin levels. You're going to do a couple of scans, ultrasounds. You have to do a transvaginal scan, which is very important to also check your uterus, check your cervix. These are things you have to do, guys. These are things you have to do. This is why I'm going to advise every lady, and from all my previous videos I've been advising, the preservation or the protection of your fertility starts from when you are born. As you can see, there are some cases where a lady will have amenorrhea and it's okay. But in some cases, after 15 years old, a lady hasn't seen her period, that's a call for concern. If a lady hasn't developed breasts, it's a call for concern. Preservation of our fertility doesn't start when we want to have kids or when we want to get married. It starts when we are born as females. So when you hit menopause, go see your doctor. If you're experiencing a lot of hot flushes, when it comes to vaginal dryness, you could use lubricant gels. Or having bone issues, let me say, because most ladies who hit menopause actually have a lot of joint problems. You need to take a lot of vitamin D. So these are things that could actually be sorted out without any problem, guys. So till next time, thanks for joining me in today's class. Till next time, I remain your seasoned and certified medical microbiologist, Gwendolyn Halley. Till next time, bye-bye.